Hi everyone, I'm Nick Lees and welcome to Digital Health on Air. I'm joined today by Harris Shuaib, a leader in strategies for practical and responsible AI deployment at health systems. Harris is the founder and CEO of Newton's Tree, which is a global AI company supporting healthcare AI deployment. And we're very fortunate to have him with us today discussing strategies for effective AI deployment enterprise-wide, and in particular what health systems can do if they've started down the AI journey but are ready for the next step. So Harris, welcome. I'd love to start by hearing what led you to found Newton's Tree.
Hi Nick, thanks for having me. Yeah, it's a long story. I've been working in the National Health Service in the UK for my entire career. Started off as a medical physicist at St Thomas's in central London, and have been involved in AI adoption from within the health system for about a decade now. And Newton's Tree started off as a solution I built for myself inside the hospital. I was trying to deploy my own algorithms that I had developed into clinical pathways and realized that there wasn't an easy way to do it. It often involved walking around with a USB stick, downloading data onto my laptop, running algorithms, emailing electronic medical record teams. And I realized that I can't spend my life running around with USB sticks. And so I found a few discarded computers and built my own server in the a lunchroom of the radiology department at Guy's is where I actually started, and automated a part of my job away, which was around how to integrate AI into clinical workflows. And then it turned out that that was quite a useful thing to do. Other people started hearing about it and said, could they deploy their algorithms on my little server? And it sort of grew and grew and grew. And now we're a global AI company.
It's awesome, inspiring story as well. And interesting to see you came from like a clinical background, could see a use case, and it's grown to this as well. So, I mean, how do you feel that AI and healthcare has changed since you founded Newton's Tree? That's at the moment, I feel like perhaps a difficult question to ask. It feels like we're moving at 1,000 miles an hour at the moment, but yeah, I'd be interested to hear your perspective there.
Yeah, it's like I feel like we've gone through like several lifetimes in AI in healthcare and AI in general. And sort of I grew up in probably what you people call the second wave of AI, particularly in healthcare, where it was mainly sort of deterministic models, image features and image analysis, sort of inheriting a lot of the tradition from sort of Google and Facebook, finding cats and dogs in images, but instead it was sort of tumors and lesions in radiology images, and that's my background primarily is in radiology. And there was some progress made with radiology AI and image analysis. It didn't really take off like people expected it to, particularly sort of pre-pandemic. I sort of box it in my mind as sort of pre-pandemic and post-pandemic, or pre-ChatGPT and post-ChatGPT. Those are also similar sort of markers. And the challenges early on with sort of the first generation or second generation was, lack of infrastructure, lack of reimbursement, lack of buyer confidence from a health system side. But we were making slow progress, and then LLM sort of happened and completely changed the art of the possible, but also opened up interest and excitement in non-clinical use cases. And actually, I think in the early days, and sort of pre-LLMs, we were focused on the wrong problems, I think, or at least weighted incorrectly. And I sort of committed that mistake, definitely in my academic career. I spent my academic career researching brain tumor prognosis. Very important problem, but incredibly niche and, rare disease. And the health system has much more fundamental problems that AI could help solve, like billing and scheduling and patient communication. But that wasn't the sexy stuff, not for academics like me, until, LLMs came along, and that kind of changed the script. And we've seen an absolute explosion. Like it's like being on a literal roller coaster. And it's great for a lot of reasons, in that there's been huge uptake now, both of, generative AI, but also traditional AI, as people have become more familiar in their everyday life of how AI can help them. So that's been real positive. Like AI has become accessible to the layman and to the average person. And that makes it much easier to have conversations around AI with health system folk. But then it's also thrown up loads of challenges, right? Around infrastructure, reimbursement. And those things have come back around again, which is like, okay, how do we make the business case? Like we get it, it works, and it's really exciting and transformational. But now how do we make this business as usual? And how do we capture the gains that we've delivered? So it's a really exciting place to be right now.
Yeah, for sure. And it feels like now AI is kind of like everyone knows who it is, right? Or what it is, right? Since, I mean, you mentioned a minute ago about the pre and post GPT era. It feels like it's completely different now, because I feel like I can have a conversation with my elderly parents about it and they know what an LLM is to a certain point, or they think they do and know what ChatGPT is. So have you felt like there's been a big like acceleration since then for sure?
100%. And
Yeah.
education, both for healthcare professionals, but also patients and public, has taken a massive leap forward. So in one of my other roles in the health system, I was until recently the national director for the Fellowship in Clinical AI, which is a national education program in the United Kingdom to help sort of early mid-career healthcare professionals take the next step in sort of AI leadership. And one of the challenges we used to have was like trying to get people to understand the way AI algorithms behave and the positives and the negatives and the challenges around how they can be used. Whereas with ChatGPT, it's much easier to communicate those opportunities and risks, right? Every hallucination has had a revival in people's lexicon, right? It becomes really obvious to put an example into ChatGPT and show how powerful it can be, whether it's, summarizing a meeting or doing sort of initial diagnosis or triage, but also showing how it can fail and trip up. And because it's in language, it's not an X-ray, right? An X-ray is not interpretable by the average person, but everybody can read an essay or
Yeah.
letter, right? Everyone can read a letter, and it's very easy to spot mistakes in a letter. And that's made education and patient communication a lot more easier.
Great. I mean, something I've seen you kind of like speak about frequently, like on LinkedIn, etc., is like the need for like a more robust health system frameworks around AI. Whether it's government or digital literacy training, or a solid risk management process. I mean, where are the health systems you've worked with? Where are they in terms of AI adoption? I mean, are they still in the pilot stages, or do you think like most of them even beyond that now?
Yeah, it's very hard to talk in generalities in this domain. So there's a broad spectrum, right? So a lot of health systems are still taking sort of their first steps when it comes to governance around safe and effective AI adoption. And there's others that are sort of streaking far ahead. And there's sort of the usual culprits, sort of the well-funded AMCs who have sort of big research teams and AI experts, really phenomenal and leading edge stuff when it comes to safety and monitoring of AI and, like you mentioned, risk management. Having said that, a lot of it's still a developing science. We were just at RSNA last week, the Radiological Society of North America, chatting with some health system folks around how do you evaluate the correctness of an LLM? Like, that's a really fundamental question
Yes.
that we don't have good answers to. Like, what is right and wrong when it comes to clinical history? But not all of it is such an open question. Some of the tried and tested methods of clinical governance, like audit and evaluation, people are now recognizing like, hey, we need to do the same stuff when it comes to AI technology, like stuff we do in clinical services, like measure how good we're performing. We need to do the same stuff with AI technology. And one of the key things that Newton's tree tries to do is provide not only the technology infrastructure, but also the expertise on how to do that properly.
Great. I mean, and how do you see this evolving over the next year? I mean, I'm sure like the trend from our conversations has been this is only going to get like bigger and more complex potentially. But yeah, where do you see these things changing for the new year?
Yeah, so it's going to end up becoming a bit like sort of information security and information governance, right? So as digital infrastructure became more and more critical to healthcare operations, whether it's in on-premise data centers or in cloud services, information governance, information security is critical, right? And investment in cybersecurity tooling, processes, infrastructure. You can't run any modern operation, let alone healthcare operation, without it. And it's going to be the same. And people are realizing with AI technology is that it's going to need its own infrastructure, set of processes and policies to make sure that we're always assured and safe when it comes to using these technologies so that we can benefit from the upside, just like with digital technologies. And it's going to be a shared responsibility. Again, just like cybersecurity, it's not just on the health system. It's going to be a mixture of health system, vendor, and then there will be some third party. And that will be a mix of vendors like ourselves. There will also be some kind of state or legislative function, I think, or government function that will have to develop. and just like it did with medicines and digital technology.
Yeah, it's interesting the comparison to just thinking about it like you would information security or cybersecurity. I know Elion released some like recommended governance like recently, about like the structure of working groups and things like that. So would you see it that way that like a company can't just think of this as like a little silo? It needs to be something that like lots of different departments and stakeholders have input in to almost like feed up to an AI steering committee or something similar.
Yeah. This the AI steering committee is a really interesting concept. So I was fortunate enough to build the NHS's first AI steering committee at Guy's and Thomas's back in 2017-18. And when I did that, in the terms of reference, I said that this was a temporary measure because we had this novel thing on our plates that all of the different sort of governed stakeholders, whether it was commercial, clinical, technical, or what have you, needed to sort of come together to solve this specific challenge. But the assumption is that we would solve it and then we would go back to our normal functions and just deal with
Yes.
AI like any other technology or project. I haven't quite swung the other way completely, but I'm less ardent about that view, right? I'm not so sure that the AI steering committee is a temporary structure because of how all encompassing AI technology can become now, right?
Right.
There is a conceivable future where, over 50% of value from a healthcare system is delivered by agents of some form or fashion. And then, given that scenario, I don't think it's sensible that your AI steering committee disappears. Right, I feel like it will have business to deal with every month, and like you mentioned, it's a multidisciplinary effort, and will always be. I think the real interesting challenge is what new professions will arise from it. I have the good luck to give lectures once a year at King's College London to their medical class, their undergraduate medics. And a question I always get is, will doctors be replaced with AI? And I always say, of course, they're going to be replaced. Doctors have been replaced many times over millennia, right? Doctors, like medicine used to be a sort of a herbal science, right? A science of plants. It then became a biochemical science, and it will become an information science. And we will still call them doctors, but they will be unrecognizable to doctors 1,000 years ago. And that evolution is going to be really interesting because doctors have always been not only the deliverers of benefit, but also the mitigators of risk. And the role of healthcare professionals in mitigating AI risk is going to be really interesting. And I don't know what that looks like.
I mean, I guess what questions and challenges or opportunities do you most often hear from health systems who work with you at New Industry?
Well, I think it's nothing that surprising. The challenge that health systems have the world over, particularly with the more developed health systems, is that, look, in the current delivery model, it's financially not sustainable. It's particularly when you look sort of nationwide. The way we deliver is very much a Victorian era health system, particularly sort of UK, Europe, and the US, in that it's very hospital centric. It's very much focused around acute conditions and sort of what we call sick care rather than healthcare. And the real exciting opportunity is how to become much more proactive in dealing with the healthcare of people, and how do we make it much more person and community centered and delivered locally and in the setting that the patient prefers, right? Rather than, and I say this coming from St. Thomas's, which is 1,000-year-old hospital,
Yeah.
right? And it's very hard to innovate in 1,000-year-old hospital. And the great thing about putting healthcare in the hands of the patient in a much more proactive, decentralized way is it ultimately delivers more efficient and better outcomes. And that's the really exciting stuff. Yeah.
Yeah. So, I mean, I guess my next question, I guess you kind of answered it a little bit there, but yeah, I mean, so you think AI will it continue to be applied to like specific health system problems, or it sounds like you think it's going to become like an integral, like enterprise wide system, kind of like we think of an EHR and EMR today?
Yeah. I see it as sort of the new layer in medicine. So if you imagine sort of the patient at the top, and then initially you had sort of devices, right? You have stethoscopes, blood glucose monitors, ECG, whatever it was. And so you have these sort of primary signals. And then you had the electronic medical record and the sort of primary way way you sort of mediated healthcare was through the EMR. And there's this new layer that's developing, and it's sort of this artificial intelligence layer. And in the same way that the layers before fundamentally changed the doctor-patient relationship, like once you introduced stethoscopes and blood tests, it kind of changed the relationship, right? Same with the EMR. And the same thing will happen with AI, is it will change the relationships that patients have with their health system and what healthcare even means.
Yeah, I mean, how would you recommend, on that, how would you recommend that health systems like prioritize their AI investments?
Yeah, it's a question we get a lot. We often help health systems with sort of their AI strategy, and I hate that word, but you can't ignore it. Like you have to have a plan. And how do you plan for a world that changes so much and is so fractured, right? So every 6 months, something mind blowing happens in the AI world, and I
Yeah,
do not envy being a hospital exec, which is like, okay, great, what do I do now? And the advice I always give is design for agility. Like in every part of your infrastructure, your investment, your processes, ask yourself, like, are we agile enough for a changing world? Because if nothing else is true, that is true, that the world will change at an ever increasing pace. As a health system leader, you need to make sure that you're able to move at that pace. Otherwise, you won't be able to keep up. And so that's everything from really prosaic things like your procurement processes. Like, are they agile enough for a world where like the people that you're contracting with are changing every day and their capabilities that they're able to deliver are changing every day? All the way down to, your technical infrastructure. Like, is that
yeah.
flexible, secure, and agile enough to work with, foundation models or to new companies that are popping up every now and again?
Yeah, I mean, say you've begun implementation of in an ideal world, a very agile system. I mean, what are some steps or what are some ways a health system can make sure that the AI they're implementing is safe, it's secure, and it's ready for clinical or healthcare use?
Yeah, so this is like what we hope to provide health systems and
Yeah,
really. So health systems that have sort of cotton on to this fact that hey, we need to make investments that give us not just flexibility, but flexibility with assurance, right? So we can move fast but move safe, and they work with us to support them through the entire life cycle of AI, right? So assurance doesn't just start with the technology; it actually starts before, which is the question of what are we trying to do here, and is AI the right answer to the problem or the opportunity that we're trying to tackle? And so often we're helping health system folks before it even touches our platform. But once we think, look, hey, we're going to tackle a problem, whether it's, radiology shortage or patients showing up to appointments or medicines adherence or reimbursement, whatever the challenge is. And if we know we're going to tackle it with AI, then the question is how do I find the right vendor to work with? How do I vet them? How do I make sure it works on my data? How do I make sure it's not biased? How do I make sure it's value for money? So they work with the Newton's Tree sandbox to answer all of those questions. And then the next challenge is how do I, one, integrate it without creating a whole burden from my EMR team? And then the really exciting stuff is how do I keep an eye on it? Because
yeah,
the world is constantly shifting. And for those of you who have used, ChatGPT for a while, you realize that its behavior evolves, right? It gets better in some ways, it gets worse in
yeah.
others, and you begin to adapt along with it. And so continuous monitoring is a key part of our value proposition, right? Is once you have a health system where you have hundreds of agents doing all sorts of things, you really need a control plane that gives
Yeah.
you oversight and assurance that, hey, we know what's happening. And if anything goes wrong, we have means to be alerted and to intervene where appropriate. And then with that sort of framework and infrastructure in place, you can then move at speed.
Yeah, I mean, would you say, I mean, I know like ISO has a standard for, an artificial intelligence management system, and you could apply like an ISO aligned QMS or something to an AI implementation. Would you see value in that for an organization as well?
Yeah. The challenge though is like for those of you who have been involved in like applying ISO processes, which I'm sure you have, Nate,
Yeah.
is that like the
Yeah.
devil's in the detail, right? And you can never get away from needing deep expertise, both in the technology and in the domain. Like I've been involved in writing ISO standards. I was the author of BS 30440, which is actually a British standard around how to validate AI in healthcare. And I would never hand that over to sort of like a layman or someone who doesn't have deep AI expertise and be like, hey, here you go,
Yeah.
here's a recipe book, have at it. Like that would be ideal, but we're not there yet. And so, yes, we should, as much as possible, rely on, you know, standards like 42001, which is a generic AI standard,
Yeah.
non-healthcare standard, and also the BS1 that I referenced. But in reality, it's a mixture of policy, platform, and people, right? And it's the culmination of all three, right? You can have like the best AI team in the world, but if they've got no policy or process to follow or no platform technology to help enforce, then it's not going to happen. And and that's the same thing in the cybersecurity world, right? You've got to have the
Yeah.
expert, you've got to give them the tools, and you've got to have a defined policy for the organization. And only when you have the trifecta do you actually have a safe and effective operation. And it's the same.
Right.
Yeah,
Yeah, I was going to say you could follow the standard, but it makes you compliant with the standard. Doesn't necessarily make you secure. Yeah.
exactly.
Yeah. And all right, so I guess moving on from this a little bit, let's say you've got a health system that have several departments that have been piloting different AI products and workflow, maybe both clinical, like we've talked about, and operational. They might already have a steering committee or a stakeholder who oversees AI. I mean, what action would you recommend that the health system takes from there, to create then like a robust, like enterprise approach to AI?
Well, it's the point I was making right at the end, which is like, how do you tie the three things together? Because what you don't want, I mean, what some health systems have done is, I guess, taken a relatively conservative approach and gone out and set up these sort of governance committees, which sort of act as gatekeepers, essentially, right? Which gatekeeping is an important function in governance, right? But ultimately, the purpose of everyone in a health system is to help the patient, right? And yes, preventing harm is an important part of it, but so is advancing cures and interventions. Like we have to do something. The health systems are not often dealing with perfectly healthy people. There's always a problem to deal with, right? And so there's always something to do. And so it's not enough for governance committees to just act as a defensive shield. There has to be some positive action. And so the next step, once you have a health system that's set up a governance committee, is to then, well, the first thing is to prioritize, like, hey, what are key issues, bottlenecks, opportunities that our health system is dealing with that AI could be a good solution to? So how do we get on the front foot, right? And then you set out an AI agenda being like, hey, look, we are interested in these use cases, A, B, C, and D. And then you can go out to market and engage with vendors that are potentially offering A, B, C, and D. And then the question comes, which I talked about earlier, which is that, okay, you have, and if you look at the Elion marketplace, sea of vendors, like particularly in certain domains, right, that are potentially solving a problem. Then it's like, how do I find the best vendor, the best value for money, the one that's safe and secure? And then how do I make sure that they're still performing at their best? And so those should be the key items and agenda for a governance committee once it's set up, is like, hey, how do I set out an AI roadmap? And then how do I get the right infrastructure in place to then execute on that roadmap?
Excellent. Well, Harris, thank you so much for your time and your insights today. It's been great catching up with you on this, and I look forward to following you and chatting again.
Thanks, Nick. It's been great chatting.
Thank you. Do we just end? Cara may need help here. Thanks for chatting, Harris. I try and I think I maybe like interrupted you like once and cut you off, but I try and let you speak and be the expert. So yeah, thanks for all your insights there. It was super interesting. So I know everyone's gonna get a lot out of it. So
yeah, because I ramble a bit. So I was like, I'll try and get to
I don't think you rambled at all. It was really interesting. So cool. Well, I know you've got children to get back to and an evening to have. So I think we can just leave and drop off. So I think we're all good.
It just says 99% uploading, and I don't want to like drop off.
Yeah.
I don't know if Cara's still live.
Yes, I don't know. I'll send her a screenshot on Slack. Yeah, just before we both disappear and have to re-record this.
When the recording is done, you may need to stick around a little to upload your high quality recording. But I don't know who's. Yeah,
I just asked her if we should wait for. Oh yeah, she's asking if we can stay on for a second. So no problem. So
how are things with you?
Good. We're busy. Kind of rounding up the end of the year. Like straight after Thanksgiving in the US, it feels like it's just one like crazy race to the end of the year where you're trying to like get hold of people who've like already kind of like checked out a little bit, before the end of the year. But yeah, things are good. Yeah.
What do you do for Christmas? Do you have family back home, or do you stay there? Or
Yeah, well, my family just visited the US actually. They left yesterday, so they were here like over Thanksgiving and stayed for a couple of weeks. Then yeah, we used to go back to the UK every year at Christmas, but now we have a 6-year-old daughter, so we're trying to like create the memories at home really now. So we've stayed here the last few years, which is kind of nice. So yeah,
Makes sense.
yeah, cool. I don't know if we still have to wait. So I'm sorry about this. So
No, it's fine. I've actually got another call with the US health system in about 20 minutes.
yeah.
Yeah.
How are you finding the conversations like with the US folks? I mean, I spoke to Robin a few weeks ago about HIPAA compliance and
Yeah.
stuff. I'm not sure the conversation was super useful to him, but yeah,
I love Robin. He's a great
yeah,
speaker. Panics a lot. No, it's good. Contracting takes forever, which is fine. I mean, it is what it is. Yeah, I mean, I'm learning. The thing is it's so much more heterogeneous. Like in the NHS, you spoke to one NHS trust, they're kind of all the same. It's all
yeah,
the same characters, the same economics, the same incentives. Whereas yeah, I've got a call with like Tanner Health, and then speak to Mass General, and it's like completely different world. It's like a different universe. Might as well be
yeah,
businesses. Yeah. So that always takes a bit of like refining. But yeah, we're early days, and so like I feel really fortunate compared to like you guys, where it's like, hey, like if we get one thing good happen this week, like
yeah.
amazing, because it's gone from like 0 to 1. So yeah, I appreciate that.
Cool. Well, Kara said you're okay to drop off because it will upload on my side. So thanks again. And if there is anything I can do to help at all with compliance stuff or anything, just feel free to reach out anytime. So happy to help at all.
Appreciate it, Nick. All right. Have a good day.
Cool.
Bye bye.
Thanks, Harris. Appreciate it.